This is Taking Stock on Bloomberg. I'm Pimm Fox. Healthcare reform, a debate that continues in Wall Street and in Washington and in the Supreme Court. I recently sat down with the chief executive of the nation's oldest proprietary healthcare organization, Interim HealthCare. Kathleen Gilmartin runs a network of 300 franchises across the country that care for about 50,000 people each day. Now, as a player in one of the most controversial political debates today, Gilmartin shared her views on the role of insurance companies in the United States.
Insurance companies have recognized that being able to deliver care at home is very effective, and it's also quality and cost. The coefficients are very effective. So we deal with a lot of the national long-term care insurance companies, the commercial carriers. Everyone wants to be able to allow patients to be at home in their own setting and get the care that they need.
We, of course, await the Supreme Court decision on reforms that have been put forth by the Obama administration. Do you have any thoughts on which direction that might go or what kind of health care we're going to end up with?
I don't know the answer to the debate. I think this whole debate about whether or not individuals have to be mandated to have insurance, I think the Supreme Court will give us that decision in June, and I don't know the answer. My opinion is we probably will see them not strike, they will strike it down. And I think we're going to be in an environment where there's going to be more evolution about what is covered in care, and really that almost brings us to that nature of hospice and end-of-life situations and issues that patients have to deal with. We provide that care and dignity in the home, and that's what most patients want. So hospice is probably one of the underutilized services that are there today in healthcare.
What has changed for the nurse practitioner as well as for the physician since you entered the business? How has that changed in terms of being able to provide the level of care that they want to?
Well, I think what I've seen in my career as a nurse is that nurses have, in fact, asserted themselves more in being able to guide patients, give them education, give them all the tools and resources to really provide more self-care. The days of, the nurse will do it or the doctor will give the command and that's what is done has really radically changed. Physicians and nurses work much more collaboratively. The whole movement of transitions, what's referred to as this continuum of care, it's one of the reasons we feel so strongly about providing a continuum of care from personal care all the way up to end-of-life services, is because there has to be this handoff, this almost coordination between when you're in a hospital and a nursing home, you go back to your primary care doctor, and we've developed specialty programs of transitions at home that help meet that need. So we're very integrated with all the other healthcare providers. That's probably the biggest change I've seen.
What about meeting the need of skilled workers? Do you get the kind of skilled people that you need to fill these jobs? I mean, is it a growing industry where people can apply their skills?
Well, healthcare is expanding geometrically, and the biggest challenge that in healthcare I see is finding the right people and having people who have a passion to want to take care of patients, but also are willing to continually learn and upgrade their own skills. We provide those opportunities for nurses to learn, to balance their career with their home life and with their education. But I think overall we're going to continue to see every level of healthcare worker have to expand their skills.